बिस्मिल्लाहिर्रहमानिर्रहीम इय्याका नअबुदु व इय्याका नस्तईन अल्लाहुम्मा सल्लि अला मुहम्मदिन व अला आलि मुहम्मदिन व बारिक सल्लि अलैहि। Dear colleagues, this is male child, almost 8 year old, with history of loose motion and abdominal cramps for the last 5 years. Sometimes the pain is intense and sometimes the pain is vague. However, the motion are off and on. In spite of treatment, the child is not getting relief. So I'm going to scan the abdomen with the high frequency probe. So I have placed the probe just above the umbilical region, and we can appreciate this is the small bowel jejunum, and look at the movement of particles, food particles within the jejunum. So this small bowel, if we appreciate closely, we can see that this is hyperperistaltic. Loops are hyperperistaltic, and it is acting like a washing machine. As the washing machine washes the clothes with the whirling sign, this, if you closely observe, this hyperperistaltic movement of the jejunum also doing the same as the washing machine. And this echogenic foci within this intraluminal contents, and these intraluminal contents are basically the putrefied food particles. So I am going to drag the probe downward. Here we can appreciate this one. This is the lymph node which is enlarged. So lymphadenopathy is also present. Here is another lymph node. And now I have reached the ileal loops. This ileal loop is also hyperperistaltic. Both jejunal and ileal loops are semi-dilated, showing significant increased peristalsis and doing the action same as the washing machine does with the clothes during the washing procedure. So this is the putrefied. So basically this is the case of intestinal malabsorption. Whenever such child who has such kind of history, and the small bowel is behaving like this with putrefied food particles within the lumen, acting like washing machine, and also with bowel loops are having significant increased peristalsis, and the lymph nodes also may be present. So such cases are the intestinal malabsorption. This most likely is the case of celiac disease due to the allergy from the gluten or wheat. So look at these are the ileal loops having the putrefied food particles, hyperperistaltic, acting like washing machine, and this is the jejunal loops which that has the same behavior as the ileal loops. Look at here. Patient abdomen is not tense, it is soft, no tenderness is seen. These are the large bowel loops which is gas filled, and this is the centrally placed small jejunum and ileum. So this was the case of intestinal malabsorption. In conclusion, celiac disease due to the gluten allergy characterized by the semi-dilated hyperperistaltic jejunal and ileal loops with internal with putrefied food particles within the lumen, acting like washing machine, that is washing the clothes in swirl pattern associated with the right mesenteric lymphadenopathy. Thank you very much.